To Your Health, where we talk to local health leaders to help you feel better, live better, and be better.
Hey everybody, and welcome to Your Health. Well, today we're going to talk about post-COVID arthritis. To help us through it is Dr. Delo from Delo Sports Medicine. Hello, doctor.
Good morning.
So, didn't know this was a thing, but so many things are happening after COVID. One of the things we wanted to talk about is people experiencing what I guess they would think is arthritis after having COVID. What is that about?
So we know that COVID leaves this hyperinflammatory state. And so unfortunately what we're seeing is people recover from COVID, they're having inflammation in all different areas of the body. In my world, we're starting to see this affect the joints most frequently, often the knees, the ankles, or the wrists. And what will happen is patients will present with joint pain and inflammation within a few weeks of having that COVID infection.
How do you find out if it's truly because of COVID or if I just have arthritis or pains in general?
Well, the first hint is the timeline. It'll occur within a few weeks of having that COVID infection when you're in the recovery phase. But then we can also do lab work. Lab work will show inflammatory markers in the blood, but not the kind of markers that we see with other inflammatory diseases such as rheumatoid arthritis or psoriatic arthritis.
You'll be able to figure that out right away then. You know, because of that marker, that's COVID or that's something long term.
Well, it contributes to the diagnosis. We can also take a sample of the joint fluid, which will show inflammation and not have things like virus or bacteria, like an infection, and not have crystals like you would see with gout or pseudo-gout.
How do you treat then if it's a development from COVID? What's the treatment plan?
Well, the good thing is that it typically responds to anti-inflammatory medicines. The majority of these will respond to over-the-counter medicines like Advil or Aleve. In some situations, patients will need a cortisone injection to bring that inflammation down, but typically it is, we call self-limited. It does resolve on its own without any long-term implications, luckily.
Well, that's what I was going to ask. Are you seeing anything else in your practice that has to do with pain from COVID in the orthopedic scope?
Yes, we'll also see it affect muscles, as well as nerves, actually. We'll have nerve entrapments flare up, such as a carpal tunnel or a tarsal tunnel in that post-COVID time period.
If somebody is experiencing these things, is it better just to come see you, or should they wait it out a little bit? There's always that thing, well, should I go in, should I not? What would you say?
I would say it depends on how severe it is. If it's mild, I would try those over-the-counter anti-inflammatories first. But if it's not responding, or if there's significant swelling, pain, or anything concerning like redness or warmth around a joint, then they should definitely be seen. Well,
Dr. Delo, I want to thank you for being here and kind of walking us through post-COVID arthritis and getting people on the right track. And we want to thank you for watching To Your Health.
The preceding was a paid advertisement.